My name is Virginia Modeo Weiss, a Kenya diaspora living in Germany over 20 years now. I'm a nurse by profession, an expertise in oncology, palliative care, and pain management. That is my further studies. So I've been working over 13 years in the neurosurgical department, where I came to know about my professor. And we have been working together for the missions since 2017, where we started in Mnazi Mmoja in Zanzibar. We did 2017, 2018 and 19. Then came Corona. And after that, I was like, why can't we go to Kenya? These cases, we have them. Then he was like, it's okay then. We look for a hospital where we got Dr. Kanga and we came to cooperation with him. So since then we have the Farain or the organization Sabubwana Foundation. And in the process we came to know the Cgtrh, that is the Diaspora Affairs Office, where when we met in Berlin, where the president was signing the agreement with Germany, where the skill and technology transfer can be transferred from Kenya to Germany. So I explained our project, what we do here, and it came very positive to Diaspora Office, and they have been very much supportive to us, and thank you so much, because without you guys, I think the diasporas, they feel they are not supported with the government. You are the first people to appreciate us and to see what we are doing is good for our community. So in capacity of future plans, we want to see if our project can extend to other towns, not only Mombasa. I think there is a demand, not only here in Mombasa, but all over the country. My boss is also ready to do some seminars for all neurosurgeons, and also we are looking forward to have exchange programs from German nurses and doctors to come here, and also the Kenyan nurses and doctors to come to Germany to see how the system works. We had the opportunity to have Dr. Kanga 2 years ago in our clinic, that is University Clinic des Saarlandes, or University Clinic of Saarland. And it's a great opportunity, every Kenyan or few Kenyan, to get this opportunity to come and see the modern world, and we can transfer this care to our patients here back in Kenya. So I hope I didn't forget anything, but also we want to see in future, we also have here in Kenya also the same modern hospital like in Germany. That is also a future plan if we get opportunity to have a department for neurosurgical department. My boss is ready for it and we are looking forward. Thank you so much.
Ladies and gentlemen, colleagues, people with particular interest in our work, it's a pleasure for me to give this interview. My name is Professor Cgtrh. I'm a neurosurgeon, head of neurosurgery of Saarland University from Germany. And we have established a visiting program. Our foundation is called Sabubwana Foundation. The foundation is dedicated to improve neurosurgical care for people in Kenya who cannot afford treatment or who needs support in treatment, is in bringing technology and knowledge to the local surgeons and people who are interested in neurosurgery, and of course to cooperate with the local authorities. And this is our 7th mission, so we are here since 2021 in the West Coast General Referral Hospital. And I think for the last 3 or 4 years we have a good cooperation with the Diaspora, which supports us in our goal. So usually the mission is about 10 days, 7 days to 10 days. So what we do is we see outpatients with a neurosurgical disease. So that means spine disease, brain disease, a lot of pediatric cases. Typically it's tumors, hydrocephalus, or degenerative spine or trauma. And then we select the cases, what we can do, because we spend usually 5 surgical days in 2 theaters. So that means we have 10 theaters total to do cases. And so usually we see like 30, 40 patients, outpatients, and we see those who are on the ward already. So this time we saw 30 patients in the outpatient clinic and about 12 in the ward. We do our scheduling. Scheduling is that we put one theater usually for brain cases, because brain cases need more equipment, and one theater for spine and pediatric cases. So for this week we have scheduled actually 18 cases. So we are now on Wednesday, so it's the third day of our surgical period. We have done so far 7. We're just doing with the 8th case, and I think we will go to the case later. So the goal is to bring our knowledge and to bring this to the patients who need this treatment, and on the other hand to bring this to the local residents and surgeons who are interested, neurosurgeons who are interested in new technology and treatment. So right now we are in the theater. Actually we are with 3 local residents who are interested in this particular neurosurgical care. For the long term, we plan to further intensify this collaboration, and we are very happy to have this Diaspora support. And I hope that in the future we can achieve an exchange program with the local residents and neurosurgeons back to our home, because we are focusing on minimally invasive treatments. So like we do cadaver courses, we do endoscopic courses, and to bring this technology also here and to improve in the long term the neurosurgical care.
My name is Cgtrh München. I'm one of the doctors of the Sabowona Foundation, working here in cooperation with Ben Okanga and his neurosurgical team. It's a great pleasure for us to working here and performing neurosurgical surgeries. And here we make the follow-up. We examine or we ask the patients come after the surgery to us, in the years after surgery to us, for looking how is the condition of the patient, if the patient has any problems, any new surgical problems. We can, if a new CT scan is needed, if new therapies are needed, or if adapting of the therapy is needed. In Germany, I'm neurosurgeon, and I'm neurosurgical intensivist. I'm working on our neurosurgical intensive care unit on Saarland University, in the department of my chief, Professor Oertel. The leader of the department, Professor Oertel. Ms. Dama Philip is a patient. We have performed a surgery in the year 2023. It was a resection of meningioma. Meningioma is a tumor. It has his origin of the dual sheet, and is a growing of cells of the dual sheet, as not a tumor into the brain. It's a tumor outside the brain, but it makes a compression of brain tissue, and so it gives by compression of brain tissue, the patient can get neurological deficits. And our reason is during the surgery remove tissue as most as possible. Okay, and we, Ms. Katsuga Dama Philip, we have performed the surgery in the year 2023, and we see her each year since the surgery. And it's great that you come year by year to help us with our follow-up.
Mimi ni Henry Kahindi kutoka Ganze, Kilifi. Nilimleta mamangu in the year 2023 akiwa hali ngumu. She was in a coma for almost 1 month. Na baada ya kufanyiwa matibabu ya upasuaji, hali yake ikaanza kufunguka polepole. Alikuwa hatembei, alikuwa haongei, alikuwa tu hali hiyo. Na baada ya matibabu, nashukuru Mungu kwa sababu aliendelea kufunguka polepole, akaanza kuongea polepole, akaanza kutembea, na hatimaye kufikia sasa anafanya shughuli zake za kawaida. Anafanya shughuli zake za kawaida, japo maumivu hajaacha vile, lakini tunaendelea kumsaidia na dawa za maumivu. Ndio maana tumefika hapa siku ya leo ili kwa ajili ya kuonekana kwa madaktari.
Miaka ngapi unamleta mama? Mwaka ngapi unamleta mama kuja kuonekana na madaktari?
Mwaka huu ni mara ya pili. Tulikuwa hapa mwezi wa pili, ndio tukaambiwa tuje tena mwezi wa 7 tutaarifiwa. Lakini mwaka jana pia tulikuja hapa once, na ule mwaka mwingine pia tulikuja hapa mara moja.
Kuna pesa yote mlitoa kufanyia matibabu?
Pesa tuliolipa ilikuwa ni kule hospitali, lakini hatujatishwa pesa nyingine yote kwa sababu tulifanya katika hii hospitali ya serikali, na kuna mambo tulikuwa tufanya mambo ya dawa, na hiyo ndio tulifanya. Lakini haikuwa pesa nyingi.
Daktari ambao walikuja, unaweza sema vipi kuhusu taaluma zao?
Binafsi tunashukuru sana. Ni madaktari ambao walimsaidia mamangu. Maana hali aliyokuwa, hakuna mtu hata mmoja nyumbani alikuwa anaamini kwamba angerudi vile alivyokuwa kwa sasa. Kwa hivyo nashukuru kwa sababu ni madaktari ambao wana ujuzi. Baada ya kufanyiwa ile matibabu, uliona akiwa anaendelea kufunguka mpaka kufikia sasa. Anafanya shughuli zake za kawaida pale nyumbani. Anajihusisha hata kulima kidogo kidogo na kufanya shughuli za pale nyumbani, ambayo ilikuwa ni kinyume na alivyokuwa hapo mwanzo, maana alikuwa hawezi kabisa.
Naitwa Elvina, nimetokea Kashani.
He is suffering from a long-standing hydrocephalus. Hydrocephalus means that the CSF, so the liquid within the brain, cannot be resorbed. So that means it's produced and it increases the brain pressure. And these patients suffer from increased brain pressure, compressing the brain parenchyma. So you typically have headache, you have difficulties thinking, difficulties with vision, difficulties with gait, and incontinence. This is a long-standing disease. So it starts slowly with very subtle symptoms and then increases over years. And what we saw, she had the first imaging about 2 years ago. So there was a start of a significant hydrocephalus. And then we did a CAT scan about 2 days ago, and we saw that it was even getting worse, progressive. So what we decided is that we did an endoscopic procedure. So the endoscopic procedure is to avoid an implant, a permanent shunt. We put in a small shortcut between the ventricles where the CSF is produced and the outer area outside the brain where the CSF is resorbed. And so you open up with the endoscope a shortcut that you can just make the CSF flow through there. So basically now it's a natural situation again. We have to wait. She will improve for the next 3 months, and I think the final clinical condition will be achieved after 1 year. There is some benefit. You know, you can improve with a long-standing hydrocephalus. If it goes back to normal, I don't know, but it will improve over the next months and years.
Ilikuwa kuna mpira yenye pipe yenye haipitishi maji ilikunjana hapo ilijiroli hapo sasa ndio ikawa haipitishi maji.
Sasa unasikia vipi?
Mimi sasa niko sawa.
My name is Dr. Benjamin Okanga, neurosurgeon from Coast General Teaching and Referral Hospital and head of Department of Surgery in the same hospital. And this week, again, we are privileged and blessed to be visited by the Sorbonne team from Germany, from University of Saarland in Germany, led by Professor Ortel and Virginia, who are now coming here for the 7th time. Yeah, this is the 7th visit, so this has become an annual event. This year, they've come 2 times. We are very blessed indeed. And it is a collaborative effort, largely through Professor Ortel and Virginia, who is a Kenyan nurse living and working in Germany, to come to Mombasa and to serve the Mombasa community. For Professor Ortel and his team, they focus on neurosurgical treatment. What happens is this whole week is dedicated to treating neurosurgical conditions, whatever they may be, whether it is brain tumors, pediatric conditions, vascular conditions, spine conditions. There is no discrimination. All this is treated. This treatment happens here all the time. But there's a limitation sometimes with personnel and theater space. So the advantage that we get is, one, obviously we benefit a lot from the likes of Professor Ortel, who's a well-known neurosurgeon around the world. So really we benefit from his expertise. We learn from him. Our students get to engage with him and learn from him, and his students also. So there's that blend of knowledge and transfer of knowledge and power. So that we learn from them a lot, and they also learn something from us. And obviously, the person who benefits the most is our patient. And so for this, we are thankful. The camps are annual, and they do help for that particular time. You know, we normally have quite a large backlog in these hospitals. This hospital serves the entire coast counties. There are 6 counties, and so we have a lot of referrals, we have a lot of work, and we have a lot of backlog because theater space is limited. And for this week, we are able to work on quite a lot, and sometimes we choose the more complex cases who can benefit from Professor Ortel's experience. And this is really good. I think camps, as much as they're good, they're really not sustainable for our population. What is really needed is, one, training. That is skills transfer. That is training of our young doctors, our upcoming doctors. And it does happen here to some extent, but we need specialists, subspecialists, and that is where the limitation is. And in this case, we really would like to request the State Department for Diaspora Affairs to form useful connections, useful links with different medical facilities outside the country that are willing to collaborate with us, where they can take up our surgeons who have completed the training and want to proceed to subspecialize, or even just take our trainees, medical students, or surgical residents, or nurses, and train them and expose them. And this actually will improve the standard of care in the country. And I think this is the real value in having such collaborative effort. Thank you.